So why I wanted a home birth. And these are all very personal reasons. I am not at all one of those people who believes everyone should do a home birth. I think if you feel more safe in a hospital, if you would feel more cared for and secure in a hospital or a birthing center or in a different environment, you should not have a home birth, because your expectations are going to set the tone for the experience. I would feel more comfortable at home. Part of the reason, I had many, but I wanted to be where I could eat and move freely. I wanted the freedom to be able to eat to strengthen my body, especially if I had a long labor. I wanted to be able to move freely throughout my house. I wanted to be surrounded by a comforting atmosphere. So one of the things I did was I really emphasized, like, we got our bedroom ready. We had my home gym where I've spent a lot of time and I feel very comfortable in there. We had that already. I set up candles. Like, I did not want to be in a sterile environment with people coming in and out and bright lights. I wanted to be able to turn off all the lights. I wanted stillness and calm and privacy. And that was another beautiful thing, was while I was in labor, there was a lot of time where it was just me and Brandon in our bedroom. And the midwife and her assistants and the backup midwife and the doula, like everyone was just in a different part of our house. And that was really nice. I liked being surrounded by my pets. I that wasn't required by any means, but it was really comforting to be able to like reach over and pet my dog. I liked being in my bed with my covers and my pillows, rather than some hospital bed. And then medically speaking, I did not want the domino effect of interventions. I did not want to be pressured, which is very common in a hospital environment, even with the best of intentions. A lot of times you'll find that in a hospital, they're going to put you on a time limit. And if you don't progress within a certain amount of time, then they're going to be suggesting different interventions. And I did not want that. I wanted the freedom to birth. And if it took me 3 days to labor, and if everything was going well, I knew in advance that I want those 3 days. You know, I'm not afraid of a long labor. So, you know, I really wanted to be able to control my care. I wanted to give birth with people who I had established relationships with. Now, my midwife and my doula throughout my care were coming to my home at least monthly, and then towards the end of pregnancy, it was every other week, and then the last month, they come every week. And, you know, they can do labs. They can come, and if I wanted a cervical check, they would have done that. I didn't want one the whole time, but they would have done cervical checks. I was able to get sonograms throughout my pregnancy, and I did opt to do that. I said yes to all of the testing. They were able to monitor me for any health concerns, and if I had wanted them to come back and to make more visits, they would have done that for me. So really, the level of care, in my opinion, is superior to what you get at a OBGYN. I mean, I've been seeing an OBGYN since I was 13 years old. And I can guarantee you it's better care and it's much more personal. I mean, I'm not going to go and have a coffee with my doctor, but I am with my midwife. And I felt comfortable to tell her my story about my trauma and the medical abuse that I had experienced as a child and as an infant and a teenager. I was traumatized as a child and as a baby. And then whenever I was a teenager, I was in 2 situations where I was these days, as an adult, at the time, I just was completely humiliated. And essentially what happened the first time was I was 14 and I was in a boarding school, and they brought a bunch of people in while I was on the table. and had everyone sit in front of me and stare into my vagina, and everyone kind of got a turn at like looking and prodding, and it was just horrible. And then a few months later, they sent me to another gynecologist off campus at the same boarding school. It was a man, and he did an exam, and he, like, it just makes me sick. That's why I'm trying to think of, like, how do I even say it? But while I was in that position, he said a lot of very, like, flirtatious and sexual things, and he was pressing up against me and rubbing me, and not using gloves and things like that, that it just made me feel extremely uncomfortable. As an adult, I would consider both of those sexual abuse. As a child, I didn't have boundaries. I did not have the ability to speak up for myself at the time, and I didn't have a way to defend myself. My parents weren't there. They didn't know what had happened. So, I mean, that's a big deal. And the experiences that I had repeatedly as a child at my pediatrician were not unlike some of those experiences. And then as an infant, I was very sick. I was in positions where I don't have memories of the exact things that happened, but I have sensory memories. So, like, you know, I'll see a yellow blanket, or I'll remember what it was like to feel held down and having people shove tubes up my nose. And so there were things like that like I remember the sensations, or I remember feeling fright. So I don't have the best experiences in the medical realm. I also suffered from endometriosis and ovarian cysts for, like 12 years before I actually got diagnosed. And that was a fluke because I had my appendectomy, and the surgeon was willing to confirm and address the endometriosis. So everyone before that, I had seen maybe 7 or 8 OBGYNs because it was debilitating. I wasn't able to work easily for at least 1 week a month. And they all just told me I was crazy and that I was making it up and it couldn't possibly be that bad. But I'm like blacking out and throwing up and, you know, not able to get dressed, and I'm crawling to the bathroom and laying in the floor for hours at a time. Like, that's not normal. So to be told I'm making it up, or that I have a low pain tolerance, or, you know, it's very degrading. And then all of the money and the time I spent to try to find someone who would be able to help me, it was just such a discouraging journey. So that's kind of my experience with medicine, and why I'm not too big of a fan. I don't like being belittled. I don't like being dismissed. I don't like having my experience put down and discredited, and then be charged an arm and a leg for an appointment to have that experience. I did not want to be in that position during what should be a very joy-filled, monumental experience in a woman's life. So that is a huge part of why I didn't want to be in the hospital. The other thing is there is a domino effect of interventions that anyone should be aware of if they're going to the hospital, but I knew I didn't want any of them. When you go to the hospital, you know, they give you an IV, and I do not want an IV. I didn't want a port. The reason is because I am very uncomfortable with it. Like, they say it doesn't hurt, but it really isn't very comfortable. And whenever you're like moving around, I don't know about you, but I can feel it. And the tape, like, it just weirds me out. I don't feel like I have freedom of movement when I have an IV in my arm. I don't feel like I can fully use the strength of the arm to grip and to put pressure on. And when you have the port in the hospital, you can't get it submerged in water. So if I wanted a water birth, I couldn't get the port submerged in the water. So I'd have to keep my arm out of water at least a portion of the time. And they don't let you deliver in the tub. And there are reasons for that. If you are in the middle of a delivery and if you come up and the baby takes in air and it hasn't been birthed, if you go back in the water, it could kill the baby. So I mean, there's some reasons, there's some liability for it. But I knew I wanted a water birth. I've heard great things about it. It sounds like it really helps with the discomfort. So there's that. I didn't want the IV. The next typical intervention is, the epidural, and they're getting better and better. If you don't want it, they're not going to keep asking or pushing on you. I didn't want to be asked, and I wanted an unmedicated birth. For me, it was very important to experience the full array of sensations pertaining to birth. And it's not, I don't know how to say this without it sounding like bragging rights, because for me, it's not about the bragging rights. It's about knowing what I was created to do. I guess this is also kind of emotional. I want to feel and experience my God-given right to birth a baby. I just think it's so beautiful. I don't want to have that experience stolen from me through pain medicine. When you get an epidural, everyone responds differently to it. But it's not uncommon to not be able to move, and you certainly can't easily walk around and, move freely. You're pretty much fixed in bed. You can take different birthing positions, but you are limited to some degree as to what those are. In my case, I'll talk about that later, about my own epidural experience, but I did not want that. Whenever you get an epidural, it's pretty common to have to be put on Pitocin, which is a drug that causes the uterus to contract. And the problem with that is your body has its own rhythm of contractions. It's got a pattern already. And then whenever you introduce the Pitocin, it's going to have its own pattern. So you might not get as much of a break in between contractions because you're going to have your natural contractions and then you're going to have the Pitocin contractions. And they might be on different rhythms. So that can really tax your uterus in a lot of ways. Pitocin can also be very painful. I've heard that for a lot of women who get on Pitocin, and I had that also. I have a cute baby. I'm looking right at her and I have a real cutie and do. But I've heard from some women, and this was not my experience, that Pitocin contractions can be very painful. And they can be stronger. I mean, it's an augmented, unnatural, medicated, way to induce contractions and to cause your muscles to seize. So you're really just not in control of them at that point. It's harder to gauge when they're happening. They come on a lot stronger. Sometimes they come on a lot faster. So that was something I didn't want. And then, of course, once you start all of that, and for the epidural, you don't know if it's going to work. Sometimes people get numb on one side of their body, or they might get numb and then it wears off, or there's a number of things that can go wrong with the epidural. And then, if you don't progress within a certain amount of time after they start all of this, it's very common to go into surgery and have to have a C-section. And there are reasons for that too, because, if you're causing your uterus to contract unnaturally and causing your body to progress through labor unnaturally as a result of all of these interventions, you are going to run the risk that the baby's heart rate spikes, or that your heart rate spikes, or that you hemorrhage, or, there's a number of things pertaining to the birth that could go wrong if you are kind of forcing it along. Of course, there's a number of things that could go wrong if you are doing it natural too. So don't hear that in my commentary of like the domino effect as, oh, hospital bad. Because I mean, obviously I ended up there and I did all of those things. So I'll tell the story, but that is a factor when I was trying to decide what kind of an experience do I want to have. I did not want any pressure to vaccinate or to, I wanted the golden hour, which is where the baby comes out and you get them immediately skin to skin. I didn't want them rubbing all of the vernix off of her, which is this like white coating. It actually seals the baby's skin, and whenever you can rub it in to their skin and leave it on them, and then not wipe it off and not bathe it or use any soap for a few weeks, babies who have that vernix kind of rubbed into their skin, they end up not having as many allergies later in life. They don't have skin issues as much as other babies, like eczema and dry skin and baby acne and things like that. And there's apparently some immune system benefits to using that vernix and just like rubbing it into the skin. So I didn't want them doing that. I wanted the vaginal delivery because, there's so many things that happen as the baby is coming out through that process of being squeezed, and hormonal responses and things like that. Like, it actually squeezes the liquid out of the baby's lungs whenever they come out so they can breathe. And, if you get a C-section, they have to suction stuff out, and I didn't want that. I didn't want them to put the ointment in the baby's eyes. That's just in case you have gonorrhea. Well, they test you like 2 or 3 times for gonorrhea during your pregnancy, and if I don't have it during those 2 or 3 times, I probably don't have it. I don't want to put a bunch of antibiotics into my baby the moment she comes out. And that was another thing. If you get a C-section, or if you have, if you fail the Group B strep test, which has a very high fail rate, and a high false positive rate, then you are pretty much automatically guaranteed to be put on antibiotics at the hospital, and those go into your baby. And if you know anything about antibiotics, when you get on them, and sure, they have a purpose, don't get me wrong, I'm not against them completely, but when you do get on them, they kill all the good bacteria and the bad bacteria in your body. And for like an infant who's just entering the world, you don't want their first experience in life to be killing off all of their good bacteria. That's just like a train wreck for their digestive tract. So didn't want that. And I didn't want to have to defend myself, and I didn't want to have to defend all these values that I've just mentioned. And you know how it can be like whenever you're in a hospital environment, and this happened to me a couple times in the hospital, and I say something like, yeah, I don't want the vitamin K vaccine. Well, then you're staring at a doctor who's saying, why not? Why wouldn't you? You're not a doctor. You haven't been to school for 6 years. How could you possibly make that decision on your own if you don't have the education and experience that I do? Okay, well, I read, a few articles that were good enough for me, and it just doesn't seem necessary, well, why wouldn't you want to? It's only, and that was the least offensive one to me, the vitamin K, and I ended up doing it, mostly for other reasons, because of the way she was positioned and because of some of the trauma that she went through in birth. I thought, okay, well, that's probably prudent. I'll do the vitamin K just in case. But, I don't like being in a position where I have spent time learning, and I have spent time trying to educate myself, and reading books from experts in their field only to be told that I'm not qualified to have an opinion because I haven't been to med school for 8 years. Yeah, I'm qualified to have an opinion because I read the book from someone who went to med school for 8 years. Like, why would they write books if they don't want to be taken seriously? You know what I mean? Why should I invest my trust in their expertise if you're going to come and discredit them? And then why should I trust you, doctor, if you're going to discredit all the other doctors that I just spent 9 months learning from? You know what I'm saying? Like, that doesn't make any sense. Like, people do have an expertise and they write books and they might have a very varying opinion, and I think there's value in that. And I think I do have the right to have an informed opinion whenever I take time to read the books from the experts. I don't think that I'm disqualified just because I haven't been to med school. I have critical thinking skills. I've taken the time to view a variety of materials and hear different arguments, and I've chosen what I believe is best based on the knowledge that I've been given, just like anyone who goes to med school and who's exposed to one or two experts in their field, professors. And as a student, they have to use those one or two opinions and a few textbooks to make up their mind about how they want to conduct their medical practice. So we're essentially using the same skill set. It's just a matter of who are we listening to. And on that note, I'm going to go inside and feed this baby. It's starting to rain out here. And then I'll continue my birth story later on.